I'm Lonnie Harrison. I'm a physician trained in interventional cardiology, also certified in vascular intervention and certified in venous intervention as well. So we treat the heart, the vascular arterial system, as well as the veins. Our clinic now is primarily a vein clinic, and we do a lot of comprehensive vein treatments, both in the clinic and in the hospital. What I want to talk about today is something you may have heard of, may even have, and that's lymphedema. Lymphedema is a problem that causes great swelling in the legs, and if you've ever Googled Elephant Man, you know exactly what I mean. These are big lumps of tissue that's swollen and over time has fibrosed to the area, to the leg, that's very unattractive. Lymphedema is a problem with lymph flow. So the body has about roughly about 10 liters of fluid in the extracellular tissue a day that has to be taken out of the tissue and put back into the bloodstream. This is fluid that leaks out of the veins, basically, into the tissue. About 7 of that 10 liters is actually brought back by a good vein system, and it's brought back to the heart and recirculated. About 3 liters is taken up by the lymph system. The lymph system is fluid that is basically a protein-rich matrix of fluid that has very tiny channels throughout and between the cells of the body that gets back, and it goes into various lymph nodes along the way. It's a way of the body to fight infection through the lymph node system. And what happens over time is that these lymph channels get stopped up. Lymph can't move, and even though the veins are doing a lot of work and trying to move that fluid, the veins can't keep up with all of it. And so the lymph channels are completely plugged up, and over time, then the legs become very unsightly, large, swollen, that are a permanent type of a problem. Now, what most people don't know is that even though lymphedema secondary causes are many times to cancer in which lymph nodes have been taken out, that type of thing, the primary cause of lymphedema is actually in the veins. So the veins, what happens is when you have developed chronic venous insufficiency in the veins, then you're not moving fluid back out of the tissue very well. You develop venous hypertension, pressure in those veins. That pressure causes all sorts of problems with swelling and with even ulceration of the skin, staining of the skin with hemosiderin, all those issues, pain, heaviness, and so on. But what it does furthermore is it actually blocks the lymph channels because there's so much venous pressure, it cuts off the lymph circulation. When it does that, then the lymph circulation can't move, it becomes fibrosed, collagen is laid down, and now then you've lost your circulation in the lymph system. So you have 2 problems now, both in the lymph system and in the vein system. What I can do, however, is we'll do a vein mapping, and if you have venous problems, we fix that. If we can get to it early enough, we can actually cure the lymphedema. We can cure that lymph issue. Later in life, however, we may not be able to cure it, but we may be able to decrease the swelling in your legs by simply treating the veins. I've rarely met anyone with lymphedema that didn't have a vein component. And so I would encourage you to let us take a look and see. If we're kind of not quite certain what to do, we can send you over to do a lymphangiogram to see what circulation is like in the lymph system. It's an injection of a radioisotope in the foot, and it's followed to see what lymph circulation looks like. We rarely ever have to do that because we can do ultrasound of the veins, fix the veins, and then if your legs have that look about them with lymphedema, then we know kind of what we're dealing with. Anyway, be that as it may, come see us. Let us help you even with lymphedema. Even though there's no cure for lymphedema, there's certainly some help that we can give you, and we can refer you to a true lymphedema center. But first of all, let's see what those veins look like and see if we can help you with vein flow first.